Hi, everybody. Happy Wednesday. Happy hump day. Halfway through the week. Yippee. So I just wanted to talk about an article that I was reading last night about breast cancer, as you do, a little light reading. Um, so I think that, for those of us that have been through breast cancer ourselves or, been around a family member, friend, partner who has been through it, then we tend to have a lot of knowledge, but I think those that haven't, there's a lot of myths versus facts out there. So we are going to do some myth busting in this episode. And this is an article I read on breastcancer.org. I will link it. So if you're interested in visiting it and reading the full article, you can. I'm just going to highlight the pieces that I found to be most interesting. But breastcancer.org is such a great resource. They have so many great articles written by, medical staff. And they get all of their information from really trustworthy sources. So it's a great place to seek and gain any knowledge around breast cancer um, in a multitude of categories. So let's jump in to the myths. So, the first myth is if I don't have a family history of breast cancer, I won't get it. And this is one that I think is pretty prevalent. I actually thought this too when I was first diagnosed. So, I presented a little oddly. I was having a lot of pain, and I felt, the pain lead me to do a breast exam, and I felt a really large feeling, hard. Um, Mass on my right. And initially, when I went in, I was like, well, I don't really have a family history. I do have a family history of fibroids, so maybe that's what it is. So that ended up not being the case. And when you kind of think about, family history and the scheme of how many, women are and men diagnosed with breast cancer, only about 5 to 10% of those cancers are believed to be hereditary. So that's a much lower number than I thought. And so I think, you know, the fact is that most people diagnosed with breast cancer have no known family history. For me, I did actually, they were not anticipating, I did not have a significant family history, so they weren't anticipating, the genetic testing to be abnormal. I did end up coming back with the CHEK2 mutation, which does increase the lifetime risk for breast cancer. It is certainly not close to the risk that, say, the BRCA1, BRCA2 genes cause. So that is myth number one. Myth number two, if you maintain a healthy weight, exercise regularly, eat healthy, and limit alcohol, you don't have to worry about breast cancer. So, although all these behaviors can help lower breast cancer risk, which is well studied, they can't eliminate it. And I bring this one up because I've talked to people going through breast cancer, I've talked to survivors, and I think there is this guilt that, like, what could I have done differently? What could I have avoided? This kind of self blame that we do because we're in the thick of it. And I think, most cases of breast cancer are not related to anything we could have done differently. So, is it important to live a healthy lifestyle? Yes. Is it important to monitor your alcohol intake? Yes. Is it important to maintain a good BMI? Yes. But again, you can do everything right and still get breast cancer and any kind of cancer, right? And I think, it's unfair. But that is the reality. Um, this one I hadn't heard, wearing a bra can cause breast cancer. So I think what brought on this myth was there was a theory that wearing a bra, especially an underwire style, could restrict the flow of lymph fluid out of the breast, causing toxic substances to build up in the tissue. However, there is absolutely no evidence to support this theory. Um, I know for me, post breast cancer, I did used to wear bras with underwire, But after having a double mastectomy, then I had expanders, then I had my implants put in. Um, I tend to just wear sports bra. They're more comfortable. They provide more support. I'm still experiencing a little bit of lymphedema on this side. So I prefer, bras without underwire, and that's actually what they recommend for women after breast surgery. Just because, again, it's more comfortable. And I will say I do have some favorite bras that I have found post mastectomy, post expanders, and then implants. So I will share that in a separate video. So there was a 2014 study of about 1,500 women with breast cancer. They did a study on the underwire bra, and there was no link between bra wearing and breast cancer. So we can bust that myth. Wear whatever bra you want. So another myth, and this is a big one. This one I hear a lot. So the myth is using underarm antiperspirant can cause breast cancer. So the fact here is there is no evidence of a connection between underarm antiperspirants, that's a tough one, and breast cancer. So a lot of the conversation around this was that the aluminum and other chemicals are absorbed into the lymph nodes and make their way into the cells, which then, in theory, increase the cancer risk. So there is no strong evidence of a link between antiperspirant use and breast cancer. Some studies have shown that women who use aluminum products under their arms are more likely to have higher concentrations of aluminum in the breast tissue. So that is kind of where they are at with the study. I personally wear the all-natural deodorant, but I'll be honest, I'm considering going back just because I had an estrogen-driven cancer, so I was put into menopause. I had my ovaries removed. So I am in a constant state of sweating, and the natural deodorant just doesn't always do the job. So I thought that was an important one to share. So another one is that annual mammograms guarantee that breast cancer will be found early. So I think first and foremost, mammography is still the best early detection tool we have. That being said, and I think what this myth is getting at, is it doesn't always find every breast cancer. So it finds a lot. But I think, and if you want to know sort of numbers, it's estimated that mammograms miss about 20% of breast cancers at the time of screening. And that can be for a number of different reasons. Some of this is related to, and I think we've all heard this, that women with dense breasts are at a higher likelihood of getting a false negative just because it's harder to kind of separate out the glandular and connective tissue with fatty tissue. And then, some women can have a series of normal mammograms and then end up with an abnormal one. So this isn't saying to not do mammograms. You absolutely should, but doing a self-exam at home is so important. And I think we all have to follow our intuition because you know your body the best. You know what's normal, especially if you're doing regular breast exams. You kind of know what's there, what's new. And I think that is so important because we do have to advocate for ourselves. And as I said, when I was first diagnosed, I think I was sort of leaning toward fibroid, but I was expressing that I wanted to, get this checked out as soon as possible. It just didn't feel right. I think my oncologist sort of knew that. So they did get me in for an urgent mammogram. And at that mammogram, I was able to be biopsied, and then I was able to start chemo that same week, which is unusual, but I was pushy and I advocated, and we are our own best advocates. And as a community, we should advocate for each other. So the other piece is a myth is breast cancer always causes a lump you can feel. So that is not always the case. So some women could have discharge from the nipple. Um, there could be other presentations, redness of the skin. Um, you also could have a lump that's normal. Um, and then another kind of myth is that breast cancer doesn't cause pain. And when I was first, like before I even had my mammogram, before I was diagnosed, this was like the day before I started Googling, because that's what we all do, right? Like we are all of a sudden MDs and we are on Google and we are diagnosing ourselves. So I read, like everything I read was like breast cancer is not painful. And I was like, oh, well, that's good news. Like, because mine was incredibly painful. So I think I think the message here is that each breast cancer presents differently, and it's important to really understand all the symptoms and presentations so that when you are doing those self breast exams, you really kind of know what to look for. And again, starting your mammograms at 40, so important. And please make sure that you're doing that. Um, so I think another one is that all breast cancer is treated pretty much the same way. I think there's that. And then I think also like people have kind of archaic ideas about what treatments are still being used. So my mom was one of my best supporters when I was going through breast cancer, and she was actually an oncology nurse for many, many years. So um, when I was diagnosed in my treatment plan, she was just surprised at all the new drugs. And I think that is the wonderful part about breast cancer, cancers. We are making so many strides through amazing research. Women are living longer. There's more studies out there. There's new drugs. So I think, how you're treated is so dependent on the type of breast cancer that you have. Is it hormone positive? Is it triple negative? Stage, age. So all of these factors are going to play a role in the treatment plan that your oncologist chooses. I say this because I did it myself, and I've heard other women do it. Part of being, a doctor on Google is you read other women's stories. And I think you always want to like read the good stories, like people that have lived for, 25 plus years, and you want that reassurance. And you should read those stories, and those should give you hope. But then you look at the bad stories. Like I remember when Shannon Doherty died of breast cancer, and I sobbed, not because I knew Shannon Doherty, but because she had a similar diagnosis to me, but I had no idea about her care plan. So of course I called my oncologist, who's wonderful and understands my anxiety and emotion quite well. And we talked about it, and she's like, well, she didn't take tamoxifen. So again, like you don't know the story, and each story is so unique. And each person is so unique. So I would just be weary to compare. I think this community is such a great community because we can learn from each other, we can build each other up, we can support each other. But at the end of the day, our treatment stories are all different because our cancers are all slightly different. This one I've heard, and I think that's when I was diagnosed why I was so surprised. So myth that breast cancer only happens to middle-aged and older women. So the fact is that younger women can and do get breast cancer, and as do men. So male breast cancer is much more rare, but it does happen. And it's true that being female and growing older are the main risk factors for developing breast cancer. But when we look at the numbers, in 2017, about 4% of invasive breast cancers were diagnosed in women under the age of 40, while about 23% were diagnosed in women in their 50s, and 27% women ages 60 to 69. So I fell into that 4%. I'm sure others have. That's from 2017. So I would anticipate that that number has changed. And while that's a small number, it's not zero. So when we think about this kind of globally, that what that percentage means is that 1 in every 25 invasive breast cancer cases occurred in women under 40. So even though it's a small number, it's a lot and it happens. And so I think, again, like whether you're under 40, like you should really be doing breast exams, like starting from a young age. We are our own best advocates. I can't emphasize that enough. And being in tune with your body is really going to help you know when something is off or wrong or doesn't feel right. And when that occurs, seek medical care. Follow your intuition. Don't wait. Don't just say, oh, put it off. I'll see what happens. So I think, I think there's no way of knowing, but I think knowledge is power, and really understanding kind of all of these myths versus facts is super important for all of us. So I'm going to end with this last myth because it's one that's important. So when treatment is over, you're finished with breast cancer. So this is kind of the phase I'm in. So I finished my traditional treatment, which included, so because of the size of my tumor, I was stage 3A and lymph node involvement. They started with chemotherapy. And so I did, I think 8 rounds of chemo. And then they did the mastectomy after that. And then I had radiation. And then I was always hormone positive. So I started being ER/PR positive. And then my final diagnosis post mastectomy was ER positive. So I qualified for hormonal therapy or endocrine therapy. And so I'm on Arimidex, and I'll be on that for 10 years. And then Verzenio, also known as abemaciclib, I'll be on that for 2 years. So I'm actually a little over a year. I've got a little under a year left of taking. And I remember saying to my oncologist, like my treatment's over. And she's like, the most important part of your treatment has begun, which is this endocrine therapy, because that really does and has shown on studies to help prevent cancer from coming back. So I really took that to heart. And I think too, like people around us, right? They're like, okay, you're done, you're better. And kind of that warm cocoon, I know I love that word, of support sort of goes away. But we still have side effects. We still feel fatigue. We still have PTSD. So be gentle with yourself. If you're like me and recently out of traditional treatment and now on, endocrine therapy, tamoxifen, Arimidex, whatever it is, this is still such an incredibly important part of your treatment. And, it's still causing side effects, symptoms, all of those things. So be gentle with yourself, allow yourself to rest, and recognize that, you're a warrior, and we're still fighting. And, I'm excited for the future, as I read more about these new treatments. I have a lot of hope. And so I wanted to share that with all of you. I will post a link to this article because I think it was a good read. I thought it was interesting, and I wanted to highlight the pieces that I found most interesting. So have a great Wednesday, and I will post again soon. And don't forget to subscribe.